Today, in conceptual surgery, we'll be talking about a very different topic, very unusual topic, which I think we all will become surgeons, uh, and we'll have to face some realities which define this word and globally. So, I think it is very pertinent to for you all to understand this topic uh, from your training period, so that when you're out there in the world, you know what the word demands from you and what the responsibilities are on us as a surgeon. So today the topic is safe surgery for all. Now each word means a lot about it, and I'm sure towards the end of the session uh, you'll be sure that what all this phrase means, that what is safe surgery for all. So so this main theme of safe surgery for all is a goal for global surgeons all across the world. Now, what is a global surgeon? Uh, so global surgery, if you just hear the word, I think it means that somebody who does surgery everywhere in all countries or globally, but it's slightly different. So whenever we say that we do surgery and it is available to all, that is global surgery, and like all kind of procedures are available to everyone irrespective of where they live, irrespective of how much they earn, how much money they have. So that concept is global surgery, and you can understand that a lot of people do not get access to surgical services or treatment. So there are a group of surgeons who are active and work just on this area, so that how we can make this surgical services available to everyone. So global surgery is an area of study, research, and practice and advocacy that seeks to improve healthcare and healthcare outcomes and achieve health equity for all who need surgical and anesthesia care. So whenever you talk about global surgery, it talks about surgical specialties, which include surgery, which include obstetrics, which includes anesthesia, and which includes trauma. So these are the four main domains of global surgery, with a special emphasis on underserved population and populations in crisis. It uses collaborative, cross-sectoral, and transnational approaches, and is a synthesis of population-based strategies with individual surgical and anesthesia care. Now, this statement or definition was given by the Lancet Commission, which created a report which is guiding the whole global surgery movement. This came in 2015. Now, so we'll talk about this now. Whatever practice you do in life, you are a private practitioner, you're an academician, you're a researcher, whatever you do in future, I'm giving you a metric by which you can measure and improve your service. Okay. Now, so how do we measure our services? So there are three dimensions of measuring anything and then improving that. Now, first, access is the quality of care. Okay. So whatever we do, it should be of high quality. So you can start with doing one procedure or a range of, let's say, 5 to 10 procedures in your clinic, in your hospital. So in your armamentarium, there are those procedures, and you do it at a top class quality. You are the best in that. So that is one dimension, that you keep improving the quality of whatever you do. The second dimension is the range of services, that how many procedures do you do? How many procedures do you offer? So sometimes you'll hear people that, okay, I don't do this procedure. But as you grow, I think if you keep increasing the range of services, your business, your work, or whatever will improve. So if you're owning a hospital, you keep adding more procedures, more services. That is how things will improve. And it holds true for anything, not only just healthcare, but for anything. And then the third dimension is the access. Now, right now, let's say I have a center in Delhi, so I can give access or give care to Delhi population or to people in Delhi. But even in Delhi, I have one center, let's say. But with time, maybe I will open more centers in other parts of the Delhi, then maybe in other cities, then maybe in other countries. I will start doing OPDs in some other countries or some other cities. So this is how I increase the access. So any service can be defined by three dimensions: the quality, the range of services, and the access. And you keep adding these three. Now, in terms of global surgery, again, we talk about all these three things, that in a particular hospital or in an area, what are the range of services or how many procedures are being provided? What is the quality of them? And is it available to everyone or not? Or is there any bias, or is there any geographical advantage to some people? So all these three things we study. Now, there are two terms in terms of access. Now, uh, so in this vertical axis, which is the range of service, now it's very difficult for anybody to say that I have to provide all the surgical services. Now, there's a huge list of surgical services, of procedures, of surgeries. One person cannot do all, right? So a group of people under WHO, they defined as something called as essential surgeries. Like essential surgery is something which should be there in every surgical center. Okay, so that's why you can see a different dot, that this is universal coverage of essential services, that these services are should be available to everyone. Okay, and on a very high quality. So that is why this is the dot which we have to achieve. If you're here somewhere, you have to increase in this axis and the depth, and so that this is the direction we are going to follow initially. Once you have all the essential services, then you can start moving towards more range of services, so that you reach towards a universal coverage of surgery. So this cube is very important. Now this whole theory can be applied in your own practice also. So we'll talk about each dimension one by one. Now, the first talk is about access, like is it available to everyone or not? Now, I want to present some data, which is global data. Now, this figure is a very famous figure given by Lancet Commission. Now, in this, the graph is showing the proportion of population without access to surgery. Without access to surgery, like means more the red is, that means that population is having no access to surgical services. When I say surgical service, means either because of money or because of non-availability of any center or a doctor or a surgeon or an anesthetist or equipment, or if the center is available, it may not be affordable, it may not be safe. So if you see India, India is a deep red. So 93% of the population in sub-Saharan Africa and 97% of the population in South Asia. 97%. I'm not wrong in this. So 97% of the population don't have an access to safe and affordable healthcare or surgical care in Southeast Asia and Africa. This is a huge figure. Okay. Now that is the problem statement we are working against. If we see other uh, dimensions, now this is operations performed per 1 lakh population. Okay. So the standard is, I think, 2000 we are supposed to perform to for a safe area. In India, it is less than 1,000. Then you can see this graph, that as the developed countries, you see they're deep green, whereas Africa and Southeast Asia, the numbers are much below what is standard, what should be there. Surgical workforce, if we see how much surgical workforce we have, that includes surgeons, anesthetists, obstetricians, OT technicians, operating nurses. So if you see this data again, you can see the density corresponds to the number of surgical procedures. So globally, you can see there's a scarcity of surgical workforce in Asia and Africa, and there's some parts from where there's no data at all. So that is also scary. Whereas only few countries are able to boast that they have a adequate surgical workforce. Now let's talk about India. What's the status in India? In India, we have 91 doctors for 1 lakh individuals. So this is for doctors, not surgeons. Please be careful. Now, but the whole thing is we need around 100, let's say, okay? But the thing is, it is not distributed equally. There are some parts which are much less, around 30 to 40 or 70, and then there's some part who are 150 and 172, 195, 197. So again, the whole overall country data might be okay, but this is the problem, that a big chunk of mainland in India, they don't have adequate number of surgeons and doctors. And I know you this is not a usual topic, but uh, it is very important for the overall surgical fraternity and the surgical healthcare. And I think we are in this practice because we want to uh, improve the system. And again, that's also quality improvement. So we want to improve the system by doing more things to more people, and then at a high quality level. Again, that cube uh, comes to mind. Okay, so so with that, I wish you luck, and I wish that this will change a bit of what we practice and how we practice, and that will be humongous in terms of the impact. So thank you everyone. We'll be back soon with another topic, another video of relevance to surgeons. Thank you.